Welcome, ladies and gentlemen. My name is Refferty, with the last three digits of my student ID, 003. And in this occasion, we're going to talk about a student project with the topic Meniscus Injury made by STD-P2. Next slide. Here is the list of our group members. Next slide. Chapter 1 of our student project, Introduction. Next slide.
Hi, my name is Putu Sri with last three digits of student number 201. I'll explain the background of the student project. Menisci play a crucial role in load distribution and joint stability, comprising peripheral, middle, and inner zones for stress absorption. They are crescent-shaped fibrocartilaginous structures within knee joint, aiding in shock absorption and lubrication. Meniscus injuries, with a prevalence of 44.4%, diverse across demographics, notably affecting the medial meniscus. Sports-related activities heighten the risk, needs further investigation. Acute traumatic injuries common during sports activities and degenerative tears prevalent in elderly are typical causes. Modifiable factors like activity level and body mass index alongside non-modifiable factors such as age and knee morphology influence injury risk. The symptoms include knee pain, swelling, stiffness, and limited knee extension. Also, the diagnosis involves physical examination and imaging studies like MRI, with a sensitivity of 93% and specificity of 88%. A comprehensive diagnostic approach encompassing detailed history, physical examination, and MRI confirmation guides treatment decisions. Treatment range from conservative therapies to surgery, with rehabilitation and post-repair care optimizing outcomes. The student project aims to early recognition of injury mechanism and symptoms that are crucial to prevent long-term complications. Advances in diagnostic imaging and treatment options have improved patient outcomes, emphasizing the importance of preventive measures. In order to understand about meniscus injury, we'll go deeper to anatomy of meniscus, definition, etiology, epidemiology, pathophysiology, diagnosis, differential diagnosis, prevention, management, and also treatment of meniscus injury.
Hello everyone, my name is Ketut Omni Uttami and my last three digit number is 048, and I'll tell you about the problem formulation, objective, as well as the benefits. So for the problem formulations, these are 8 problem formulation in this student project as shown as the slides, and there are also 8 objectives to the answer for the problem formulations. And for the benefits, there are theoretical benefit and also practical benefit as shown in the slides.
Chapter 2 of our student project, Literature Review. Next slide.
Hello everyone, my name is Julyvia Gifensius and the last 3 digits of my student ID numbers are 212. So in the first topic, I will explain about the anatomy of the meniscus. So menisci are knee fibrocartilage wedges primarily composed of collagen, which makes up about 75% of them. The dense fibrocartilage, a blend of fibroblasts and chondrocyte, is called fibrochondrocytes. The extracellular fibrocartilaginous matrix is supported by T cells, which also include proteoglycans, glycoproteins, and elastin. The meniscus microanatomy is characterized by its dense fibrocartilage. The lateral meniscus and medial meniscus are connected by the transverse ligament of the tibia, while the coronary ligaments anchor them to the tibia. Menisci are connected to the posterior cruciate ligament by the meniscofemoral ligaments, also known as the ligaments of Humphrey and the ligaments of Risbeck. The parameniscal capillary plexus controls knee joint vascular supply, dividing the meniscus into 3 zones, which is a vascular white zone, peripheral vascularized red zone, and red-white zone. The white zone is more vulnerable to degenerative lesion. That's all from me, and it will be followed by other explanation. Thank you.
Good morning, doctor and friend. My name is Amelia Sasikirana Dewi with last digit 207, and today I will explain about the definition of meniscus injury. The most prevalent kind of knee injury is meniscus injury. Any activities that leads you to violently twist or rotate your knee, including vigorous pivoting or abrupt stops and turn, might result in meniscus injury. A torn meniscus can occasionally result in even kneeling, deep squatting, and lifting something heavy. There are three types of meniscus injury. They are vertical, horizontal, and complicated. A variety of symptoms such as discomfort location of the joint line, swelling, clicking, catching, locking, and the traditional giving away of the knee can be caused by meniscal injury. Despite being a frequent orthopedic disease, meniscus injury can be difficult to repair. That's it from me. Thank you.
My name is Putu Sri Dianingsih Astawa and my last three-digit number is 161. Etiology of meniscus injury. Meniscus injury or meniscal tear occurs when there is a torn or injury to the meniscus. Meniscus injuries are most often experienced by people involved in sports. The possible cause is due to an incorrect rotational movement of the knee, such as aggressive pivoting or sudden stops and turns. Another risk factor is due to excessive load that must be supported by the knee joint when doing activities. For example, lifting heavy loads, climbing stairs, or squatting. In older people, meniscus injury can be triggered by prolonged breakdown of the joint cartilage or what is known as osteoarthritis. Thank you.
My name is Putu Sri Dianingsih and my last gender of my student ID is 017 and I will continue with the epidemiology. So between 100,000 people, 60 people are approximately having meniscus injury incidences. Meniscus injury is less frequent in children than adults, but nowadays it continues to rise because of intense athletic activity, year-round competition, early sports specialization, increased awareness, and screening. Elderly population are affected with degenerative meniscus tears, which peak onset is 41 to 50 years in males and 61 to 70 in females. Athletes who play sports, people whose occupation are related to infantry and require frequent squatting or kneeling have a high risk of having meniscus injuries. In people whose MCL and ACL are both acutely torn, the tear incidence in lateral meniscus are higher than medial meniscus. People with acute tears of ACL are mainly associated with lateral meniscus tears, while people with chronic tears of ACL are mainly associated with medial meniscus tears. For the next presentation will be continued by my friend.
Now I'm going to talk about the pathophysiology of meniscus injury. The underlying mechanism or cause of meniscus injury can be commonly found during sport-related and accident events. It can be from cutting or twisting movements during sport-related events, it can be from hyperextension of the knee, and it can be from the application of great force on the knee joint that usually happens during accidents. Next slide. The meniscus injury can be specified into two classifications based on their morphology and their zone. The main morphology findings from many meniscus injury cases are horizontal tear, vertical tear, and radial tear. It is known that each type of tear have its own characteristic based on their name. For example, horizontal tear runs parallel to the tibial plateau and splits the meniscus into top and bottom halves. And then vertical tear runs perpendicular to the tibial plateau and parallel to the meniscus long axis, separating it into two parts. And then the radial tear runs perpendicular to the tibial plateau and parallel to the meniscus short axis, dividing it into anterior and posterior sections. Other types of known meniscus tear are pocket handle tear, oblique or periodic tear, flap tear, complex tear, and etc. Next slide. Now we are going to look at the meniscus zone. There are three types of zone in the meniscus: the red-red zone, the red-white zone, and the white-white zone. The zone which have The color red the most is considered to be the safe zone of meniscus injury because of the vascularization that goes in and out of the meniscus is found on that zone, the red zone and the red white zone. The healing process of the meniscus injury can be a lot faster than the injury from the white zone with no vascularization and usually get supply from the synovial fluid of the knee joint. That's all from the pathophysiology of the meniscus injury. Next slide.
Hello, my name is Fatti with the last digit of my student number is 103. On this part, I will explain how to diagnose meniscus injury. As you can see on the screen, these are some of the diagnostic maneuvers to diagnose meniscus injury. It consists of anamnesis, orthopedic physical examination, special test, and imaging test. First, anamnesis. We will take the history of our patient using 7 sacred and fundamental of 4. In the screen, I listed the important point that you need to collect from the patient. The second is orthopedic physical examination. We will perform look film of examination and search for any abnormalities or information that can lead you to diagnose meniscus injury. You can do that by observing the patient's lower extremities in various positions, analyzing their gait, and evaluating their ability to squat. The third one is special tests. In meniscus injury, there are several special tests that can be done, but the most common and have the higher sensitivity to diagnose meniscus injury is McMurray test and Apley test. These are the pictures of McMurray test and how to do it, and these are a picture of Apley test and how to do it. Special test is very helpful to help to diagnose meniscus injury, and also it can exclude any other differential diagnosis. The last diagnostic maneuver is imaging test. You can perform an X-ray, but it is less effective than MRI, which have a specificity of 88% and sensitivity of 93% to diagnostic meniscus injury. That's all from me. Thank you.
Hi everyone, my name is Ngurah, Bagus, Bhismaka, Ariel, Putra, and my last 3-digit numbers are 1 to 4, and now we will talk about the differential diagnosis of meniscus injury. First is ACL injury. Meniscus injury may occur alongside or following an ACL injury. It is believed to be caused by the same mechanism of injury the two conditions have. Acute ACL injury is commonly associated with lateral meniscus tear. Meanwhile, chronic ACL injury is commonly associated with posterior horn of medial meniscus tear. The symptoms include generalized pain in the knee joint, popping sounds, and giving away sensation. Second is osteochondritis dissecans, or OCD. It is the detachment of a small fragment of bone and cartilage from the end of bone within a joint. The symptoms include pain, swelling, giving away sensation, stiffness, and locking or catching sensations. OCD may coexist with meniscus injury and other conditions, especially if there is a history of knee trauma caused by repetitive stress or microtrauma in the joint. The common location for OCD is at the femoral condyle and the tibial surface in the knee joint. Third is medial plica syndromes. It is a condition in which plica folds in the knee joint become irritated and inflamed. In the knee joint, it is commonly caused by continuous friction across the patella or the medial femoral condyle due to overuse or overactivity. The symptoms may include pain, instability, clicking, and catching or locking sensation along the inner side of the knee. The pain is usually localized above the joint line. Fourth is loose bodies. Loose bodies are fragments of bone, cartilage, or other tissue that detach within the joint space. This condition can be caused by several factors including trauma, osteochondritis dissecans, osteoarthritis, degenerative disease, and other inflammatory conditions. The fragments may move freely in the joint synovial fluid and become trapped between the articular surfaces, causing pain, swelling, catching, locking, and instability sensation. Imaging tests may help identifying larger loose bodies fragments. Fifth is patellohumeral syndromes or runner's knee. It is caused by several factors including muscular imbalance, patellar malalignment, lower extremity misalignment, overuse, or trauma. The symptoms include pain during activities involving knee bending such as walking, running, squatting, climbing stairs, or after prolonged periods of sitting with knees bent. Also swelling, giving away sensation, grating, popping, and instability. The pain is usually localized in the anterior part of the knee joint, particularly around or behind the patella where it meets the lower end of the femur. 6 is osteochondral fractures. An osteochondral fractures involve damage to both the cartilage and the underlying subchondral bone. This type of injury can occur from a direct impact to the lateral or medial part of the knee or from knee flexion rotation injury. The symptoms include swelling, intense pain, difficulty in weight-bearing activities, and limited range of motion during flexion and extension. The pain is usually localized at the medial aspect of the patella and lateral aspect of the lateral femoral condyle. Lastly, Salter Harris fractures or facial fractures. It is a fracture which occur at the growth plate of a child's bone, commonly during growth spurts when the growth plate is particularly vulnerable. Falls, collision, cross injuries, and other traumatic events may cause this condition. The symptoms include localized pain, swelling, and tenderness around the growth plate. In the knee joint, this condition is commonly occurs on the proximal tibia.
Please let me introduce myself. My name is Julyvia Gifensius with the last 3-digit registration number 088. I will now explain about the methods to prevent meniscus injury. The first one is strength training. Key muscle groups including the quadriceps, hamstrings, and calf muscles are targeted by exercises like squats, lunges, leg lifts, and calf raises, which can improve knee stability and lower the risk of injury. The second one is proper technique. Following the right movement patterns and avoiding sudden jerky movements can help reduce the risk of knee problems, including meniscus tears. The third one is gradual progression. Meniscus tears can be prevented by gradually increasing the duration and intensity of exercise over time, as this allows people's bodies to strengthen and adapt. The fourth one is warm up. Warming up muscles help reduce the chance of meniscus injury and lower the risk of strains to tendons and muscles by raising their temperature and blood flow. The last one is maintaining a healthy weight. It is essential to maintain a healthy weight through a balanced diet and consistent exercise, as being overweight puts additional strain on the knee joint and raises the risk of meniscus injury. That's all from me. Thank you.
Hello, my name is Skylenn Hertanto Tan with the last 3 digits of my student number is 145, and today we will talk about the treatment of meniscus injuries. For minor meniscus injuries, non-surgical treatments may be sufficient. These include protect, rise, ice compression and elevation, also known as PRICE, to reduce inflammation and pain. Physical therapy and bracing may also be recommended to improve knee stability and function. As for more severe meniscus injuries, surgical intervention may be necessary. Arthroscopic surgery is a common procedure and used to repair or remove damaged part of the meniscus. This also involves making small incisions on the knee and using a camera to guide the surgeon to performing the necessary repairs or removing damaged tissues. After surgery, patients typically undergo a period of rehabilitation to restore strength, flexibility, and range of motion in the knee joint. This may involve physical therapy, exercise, and other interventions to promote healing and improve overall function.
Chapter 3 of our student project. Summary. Next slide.
Hello, my name is Anak and the last 3 digits of my student ID number is 181. Based on the literature review, the following conclusions were obtained. The anatomy of meniscus. Meniscus are fibrocartilage wedges found in the knee that sit between the femoral condyle and tibial plateau. For the definition, meniscus injury is a kind of knee injury caused by any activity that leads to violently twist or rotate the knee, which results in a torn meniscus. For the etiology, meniscus injuries are often experienced by people involved in sports. For the epidemiology, between 100,000 people, 60 people are approximately having meniscus injury and is one of the most common sport-related injuries and has especially high incidence on football players. For the pathophysiology, meniscus tears result in a reduced functionality of the meniscus, leading to the accumulation of fluid and the experience of pain due to the presence of torn fragments. For the diagnosis, can be done with MRI or McMurray's test. And the most common differential diagnosis of meniscus injury are ACL tear, osteochondritis dissecans, pathological plica, loose bodies, patellofemoral syndrome, and osteochondral or physial fractures. For the prevention, can be done by exercising, warming up, and using the right equipment and techniques. For the treatment, the term PRICE, protect, rest, ice, compress, and elevate, and also peace and love, which is protect, elevate, avoid anti-inflammatory drugs, compress, educate, and load, optimism, vascularization, exercise, is effective for minor meniscus injury. As for severe meniscus injuries, surgical intervention may be necessary, such as arthroscopic surgery. For the recommendation, exploring preventive strategies and management to reduce the incidence of traumatic meniscal tears, particularly in high-risk populations such as athletes and individuals engaged in physically demanding activities, is necessary. That's all from me. Thank you.
Here is the list of our references. Next slide. That is all from our presentation of meniscus injury. We hope that the audience can get a lot of new knowledge from our presentation. We are sorry if we had said something wrong, and thank you for listening to our presentation.